The title sounds like typical internet clickbait. I understand. Doctors hate it. Classic. But let me tell you something. I'm a doctor myself, orthopedic surgeon with 28 years of practice. And I don't hate what I'm about to tell you. But many of my colleagues are indeed skeptical about it, some even hostile. Why? Because it's too simple, because it doesn't make money, because it disrupts the established system of treating knee pain, a system that brings billions to the healthcare industry. I discovered this method by accident. It was 9 years ago at a sports medicine conference in Germany. I was sitting at a lecture by a physical therapist who worked with the Olympic track and field team. He was talking about how they reduce injuries among athletes. And suddenly he mentioned one thing that seemed interesting to me. He said that most knee injuries in runners occur not from overload, but because one specific muscle doesn't activate properly before exertion. I got interested. After the lecture, I approached him. We talked for about 3 hours. He explained the concept, showed me research conducted at their facility. The data was impressive. Among athletes who performed one simple exercise before each training session, knee injury rates dropped by 72%. 72! I was shocked. I'd never heard about this before. When I returned home, I started studying this topic deeper. Turned out research has existed for over 20 years, but it's buried in specialized journals on sports medicine and biomechanics. Mainstream orthopedics simply ignores it. Why? Because it doesn't fit the usual treatment model. Here's the essence. There's one muscle that's critically important for knee stability, but has a tendency to shut down faster than all others at the slightest pain or discomfort. This muscle is called the vastus medialis oblique. Sounds complicated, but it's simply part of your quadriceps. It's innermost portion that attaches to the kneecap. This small muscle does enormous work. It stabilizes the kneecap, prevents it from shifting sideways, ensures proper gliding in the femoral groove. When it works normally, the knee is protected. When it shuts off, the kneecap starts moving incorrectly. Friction occurs, inflammation, pain, and this pain suppresses the muscle even more. Vicious circle. The problem is this muscle is very sensitive. It shuts off first and turns on last. Even minor knee pain, even slight swelling causes the brain to suppress its activity. And even when pain passes, the muscle often remains in sleep mode. It simply forgets how to work. I started testing this theory on my patients, asked them to lie on their back, straighten their leg, and try to tense the inner part of the thigh above the knee. In most people with chronic knee pain, nothing happened. I'd place my hand where the muscle should tense and felt only soft tissue, no tension. The muscle didn't respond to brain commands. Then I started teaching them to activate this muscle. The trick turned out incredibly simple. Person lies on back. A small bolster or rolled towel about 10 centimeters high is placed under the knee. Leg is relaxed. Now the task is to press the knee down on the bolster, but do it not with the whole leg, but concentrating specifically on the inner part of the thigh above the knee. Imagine you're trying to tense only this specific area. First few attempts usually give nothing. People tense the whole leg or calf or thigh, but not that specific muscle. But I taught them to feel the difference. Place their hand on the right spot, ask them to concentrate exactly there, and after a few minutes of practice, something like enlightenment usually happened. They suddenly felt how exactly this small area tenses in isolation. This is the breakthrough moment. When a person learned to find this muscle, learned to activate it, everything changes. I gave them a simple task. Do this exercise 3 times a day, 10 repetitions each time, hold tension for 5 seconds. The whole procedure takes 3 to 4 minutes maximum. Results started coming quickly. First patients I showed this trick to returned after a week saying pain decreased, didn't disappear, but became noticeably less. After 2 weeks, improvement became more pronounced. After a month, many said pain practically disappeared. I was amazed. This was too simple to be true, but it worked again and again, person after person. I started documenting cases, collecting data. In the first year, I applied this method with about 200 patients who had chronic anterior knee pain without serious structural damage. 176 people felt improvement. That's 88% success. I wrote an article, sent it to several orthopedic journals, all rejected. Reviewers wrote it was too simple, that larger controlled studies were needed, that the mechanism wasn't sufficiently explained. One reviewer directly wrote, if this really works so well, it would be standard treatment. But it didn't become standard treatment. Why? I thought about this long and came to several conclusions. First, it doesn't make money. Patient can do this at home for free. No equipment needed. No expensive procedures. No injections or surgeries. Second, it requires doctors' time to teach the patient, need to sit down, explain, demonstrate, check that person does it correctly. In modern medicine, where 15 minutes are allocated per patient, there's simply no time for this. Third, it undermines existing treatment protocols. Imagine a clinic specializing in knee pain treatment. They have expensive physical therapy equipment, plasma, injection programs, surgical department, and suddenly it turns out most patients can be cured with a simple exercise they do at home themselves. Do you think this clinic will actively promote such a method? But I continued using it and talking about it. First to colleagues at conferences. Some got interested, started trying, got similar results. Then I started posting videos online showing how to do this exercise correctly. Videos spread. People tried and wrote me thanks. Thousands of messages from people, it helped. Of course, it's not a panacea. It doesn't work for everyone. If you have serious ligament tear, if meniscus is torn and blocking the joint, if cartilage is completely destroyed and bone rubs on bone, this exercise won't help. But for a huge number of people with chronic anterior knee pain, with patellofemoral syndrome, with kneecap instability, with early arthritis, this can be that very key that unlocks the situation. The most beautiful thing about this method is it's completely safe. You can't harm yourself doing gentle isometric muscle contraction. Maximum that can happen is nothing changes. But if it works, you'll avoid months or years of suffering, avoid unnecessary procedures, possibly avoid surgery. I call this a trick, not because it's deception, but because it seems like too simple a trick for such a serious effect. 3 minutes a day, one simple action, and a knee that hurt for years suddenly starts feeling better. Why do doctors hate this? Not all hate it, honestly. Those doctors who truly care about patients more than profits usually embrace such methods with open arms. But the healthcare system is set against simple solutions. The system loves complexity because complexity can be sold for more. For 9 years, I've been using and promoting this method. I've received thousands of testimonials. Teachers who can stand at the board all day again. Runners who return to marathons. Grandmothers who play with grandchildren on the floor again. Construction workers who avoided firing because of bad knees. Each story is unique, but the pattern is one. Simple action, regularity, result. Recently, a woman came to me, 52 years old, general practitioner by profession. She heard about this method from a patient. It helped. She herself suffered from knee pain for 5 years, tried all standard treatment without much success. I showed her the exercise. She started doing it. A month later, she came again and said, I've been a doctor for 30 years. How could I not know about this? Why aren't we taught this? Good question. Why does medical education ignore such simple but effective methods? Why do we learn to prescribe medications and perform surgeries, but don't learn to activate sleeping muscles? Maybe because muscle activation doesn't fit the business model of modern medicine, but times are changing. More and more people seek alternatives to traditional approach. More and more doctors start getting interested in functional medicine, biomechanics, neuromuscular rehabilitation. Perhaps in 10 years, this simple trick will actually become standard treatment. Meanwhile, I continue telling about it to everyone ready to listen. If your knee hurts, if standard treatment doesn't help, if you're tired of endless procedures and pills, try this method. Find your vastus medialis oblique, learn to activate it. Do this 3 times a day for 3 minutes. Give it a month. Perhaps this is exactly what your knee needs. Perhaps this simple trick will save your knee too. Thousands of people already saved theirs. Why not try?